Let's talk about
politics, environmental science,
global warming,
constitutional rights,
social and economic challenges,
money, power, choice.
Nature does not compromise.
Extreme droughts, extreme heat waves.
Sea levels are rising, and it is about climate change.
This is the future of the next generations.
Hello, everyone, and welcome to Let's Talk About Climate, a podcast where we talk about climate change and how it relates to all of us. This podcast is a part of our ongoing Our Climate and Our Health series, where we explore how climate and environment shape our health outcomes and our healthcare systems. We highlight both the risks and the solutions, showing that climate action is also a public health imperative. Our goal is to inform, inspire, and equip readers, practitioners, and policymakers with information that safeguards our health in the face of environmental change. I'm your host, Manushi Sharma, and we're joined by our special guest, Dr. David Hill, the Chair of Board of Directors at the American Lung Association. Yes, so can you tell us a bit about your background and what drew you to respiratory health? And when did you first notice climate change showing up in your work or in your patients' health?
Sure. So I'm a pulmonary and critical care physician in Waterbury, Connecticut. Been in practice now for 28 years. I see actually mainly adults, but because there are no pediatric pulmonologists in town, we do see kids primarily with asthma in our practice as well. So I see patients as young as 6 years of age. And what drew me to pulmonary critical care was fairly early in my training. I knew I didn't want to be a primary care doctor because they have to know a lot about too many things. And I wanted to know a lot about a small amount of things and focus what I did, which is why I specialized. Pulmonary critical care is nice because the lungs, you just see a lot of different diseases that involve them. And on the critical care side of things, we take care of everyone with everything, but only when it's trying to kill them. So I'm really good at managing diabetes when it's out of control. I'm not so good about managing it when it's well controlled. When I think about climate change, sort of my life history with it, I can remember hearing about it in medical school when it was sort of, at least for the general population, late 80s, probably first starting to get some press. So this whole concept that human beings are altering the climate and making things hotter it's not new. We've been talking about it with lay people for a long time now. I first really got interested in the lung health effects about 10 years ago, and I was asked to give grand rounds, which is a lecture to all the doctors in the community at my hospital. And when they invite you to do that, sometimes they say, we want you to talk about some specific topic. In this case, they let me choose. And I went to my youngest kid, Sarah, who you know, and said, I'm going to get grand rounds in a month. I could talk about maybe vaping, which was a hot issue then. I said, or I could talk about climate change and lung health, because I knew there was some data. And Sarah, being an environmentalist, of course, said, talk about climate change, Dad. Mm-hmm. So then I went and pulled the literature, and it was fascinating to see how many health effects there were. When we talk about climate change and health, the effects on the lungs are one of the leading areas we need to worry about. So that really drove my passion on this. My second full-time job has been a volunteer for the American Lung Association. And I was attracted to them because the work the Lung Association does goes beyond what I can do as an individual physician. I can talk to one patient about stopping smoking, or I can talk to one patient about climate and lung health, but I can't talk to the entire population as an individual doctor. And their mission is pretty broad, but it made me much more aware of the health effects of climate change as well.
Thank you. I think to simplify, given our audience is so diverse, ranging from high school students to like software engineers who understand this is a problem but don't really understand the technical jargon. So I'll just dig in a little bit deeper. Like, what is the core of the problem that climate change creates for our lungs, and why should it matter to everyone, not just a specific like environmentalists or health experts?
Sure. So there's a number of ways climate change affects lung health. We can look at it generally in terms of air pollution as the downstream effect. So if we talk just about heat can have health effects. So when temperatures rise above about 95 degrees Fahrenheit, we see increased risks of illness and death, particularly in at-risk populations. So older people, particularly if they don't have access to air conditioning. So heat alone is an issue, but air pollution and climate change go hand in hand. So the two primary forms of air pollution we talk about are ozone air pollution and particulate air pollution. Or if we go to lay people's terms, smog and soot. So ozone is kind of the hazy, hot, humid days where the air gets almost foggy. That's a lot of ozone pollution. Particulate pollution is more from stuff actually burning.
Mm-hmm.
So ozone, if you're an environmentalist, you know it's good in the stratosphere. So we go way up in the atmosphere. There's ozone there that blocks radiation from coming into the earth, prevents us from getting skin cancer, allows us to actually survive life on Earth. So there was a big concern about a hole in the ozone layer, but ozone at ground level is bad. It's so ozone is oxygen O3. So it has a free radical on it, and that causes airway inflammation when you breathe it in. So breathing in ozone causes more asthma. It causes people who have underlying lung disease, like asthma or COPD, to get sicker, and it can cause new onset asthma. So even healthy people, when the air quality is poor, can put themselves at risk by exercising outdoors or spending a lot of time outdoors. That's one of the reasons it's important to everyone. It also causes non-pulmonary diseases, so there's increased risks for heart attack and stroke when ozone levels are elevated. The particulate pollution goes hand in hand with climate change because of things burning. So when I first started talking about climate change 10 plus years ago, I would talk about wildfires on the West Coast and how the smoke from those fires could travel as far as Chicago.
Wow.
Then the world got hotter. And a few years ago, the wildfires on the West Coast were so severe that the smoke traveled across the entire country. I was driving in Connecticut and with my windows down one night, and I looked at my wife and I said, "Do you smell that? I
Wow.
think it's wood fire smoke." And you could smell the smoke from California in Connecticut that year. A couple of years ago, we had the wildfires in Canada, which were hundreds to thousands of miles away that affected the whole East Coast. We've had recurrent episodes of that where the particulate pollution gets severe. Particulate pollution is also associated with asthma exacerbations and COPD exacerbations and heart attack and strokes. It's also associated with lung cancer. So one of the concerns, we are seeing increasing rates of lung cancer in people who never smoke cigarettes. We used to think of lung cancer as a smoker's disease. And if somebody got it, you said, "Oh, did you smoke cigarettes?" Like it was their fault. No one deserves lung cancer. Anyone with lungs can get lung cancer. And what we're seeing in the last 10 years is 25% of lung cancer in women is in women who never smoke cigarettes. About 20% of lung cancer in men is in patients who never smoke cigarettes. And we're seeing it in younger, healthier patients. And air pollution, the World Health Organization has identified as one of the reasons that's happening, and it's being driven by climate change. So those are the two big areas where climate change is associated with lung health. There's a host of other things that go on. So allergies and asthma get worse with climate change.
Yeah.
One season is about 100 days longer in some parts of the country. So the trees bloom earlier and they create more pollen, and it stays in the air longer. We have these extreme weather events with flooding, and that causes mold to develop, and people are allergic to mold. So that makes asthma and allergies worse.
Mm-hmm.
And then in other areas, you get increased desert and dust formation, which also affects lung health. So there's a whole host of those secondary effects that are also involved in lung cancer, all being driven by climate change.
It's 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 fascinating. Wow, like things that I think this also kind of segues into my sort of next question, which was on the interaction between climate stressors and the respiratory disease progression. But I guess my specific question then now would be that, many people think air pollution as a city problem, and but rural communities are equally at risk, and I feel like it's underplayed because it might not be as apparent. You might have more trees, certain like topical factors. Could you talk a little bit about that?
Sure. So air pollution is fascinating because it does not obey any boundaries. So whether they're state boundaries or county boundaries or international boundaries, air travels freely. Nobody's going to stop that. So there are certainly areas of the country and local areas that have worse air pollution than other areas. And you're correct. Inner cities, particularly along highway corridors or near industrial areas, are bad for air pollution.
Mm-hmm.
But the Northeast, which is a mix of rural, suburban, and urban, we have some of the worst air pollution on the East Coast because of the way the jet stream pulls industrial pollution and highway pollution from the middle of the country. So if you've got a factory in Ohio with a big smokestack, that air pollution ends up in New York or Connecticut or Massachusetts or Rhode Island. The smokestack gets most of it out of their air locally, puts it up in the jet stream, and then it settles here where we live. And it doesn't matter if you're living on a farm in Connecticut or you're in an inner city in Connecticut, your air quality becomes worse. Most of the country has bad air quality. So the Lung Association every year does what's called a State of the Air report.
Mm-hmm.
Based on data from air quality monitoring, looks at both particulate and ozone pollution. And you can go on their website and look it up by zip code and see what grades locally are. But for most of the country, we're failing to control air pollution well. And climate change is driving a lot of that. Deregulation under the current administration is probably not going to make that better on a national basis. But there is no safe place to breathe, and that's really a sad thing to say. And because of climate change, it's getting worse. Those hot, humid, hazy days are bad days to breathe outdoors usually. There's also a social and environmental justice issue with this because of those areas which have worse air pollution. So I talked about highway corridors. Wealthy people tend not to live right next to highways. The fascinating thing when you look at the data on air pollution is the east sides of cities, particularly here on the East Coast, the wind blows from west to east almost uniformly.
Yeah.
And the east side of cities are always the poorer neighborhoods of cities. And that goes back to, when all these cities were industrial, the factories and the slaughterhouses were on the east side because that's where the bad odors were and the bad fumes were. And it's stayed that way. So if you look at any city on the East Coast, almost uniformly, poor neighborhoods are on the east side where the air pollution is worse.
So that also ties to redlining and other discriminatory practices.
It does. And there's a lot of intersectionality among these issues. So when we talk about air pollution, rural versus urban healthcare systems being overburdened, which is separate from air pollution, but you can't isolate these effects and say one thing's just a city problem and not a rural problem.
Mo-
Comes to public health, it's universal.
That's true. I think just to follow up on that would be how you mentioned about uh, rural and urban healthcare systems, and healthcare in America is largely privatized. So I don't know in your experience if you've how health insurance companies are treating this. Is this a problem on their radar? Because again, air pollution, you go into the hospital for a symptom that you're facing because of a root cause problem, and it's
Mhm.
definitely costing us money in terms of the bills that we pay. So if you had any insights on that.
Yeah, I haven't seen a lot from the insurance industry addressing this. One of the challenges of our healthcare system in the U.S. because it's private is long-term preventative care is often not the focus of health insurance providers. They will tell you to get your flu shot every year because if you get the flu and get sick, they're going to pay for your care. But diseases that, and problems that take years to develop, odds are they're not going to be paying for your care when that occurs. They should be concerned about air pollution and climate change because it's going to affect their bottom line. Um, so I think I haven't heard a lot from them on it. We certainly on the public health side have been talking about it for a long time, and I think on the primary clinical care side of things, it's become a standard thing to talk to patients about. Whereas, when I was in training, we
Mhm.
weren't talking about climate and health or talking about air pollution and health or temperature and health. And now it's, in my line of work, a routine. If I don't bring it up, the patient does. And they'll say, "Oh, I'm doing great today, but when it was hot and humid, I couldn't breathe."
Mhm. Mhm. Yeah, yeah. I think we're sort of transitioning from like that one-off case that would experience those symptoms to more of a population level problem where everybody's sort of feeling those symptoms. I guess then my next question would be, are there any new patterns that are emerging in respiratory illness as climate events intensify?
Sure. So I think, certainly the number of poor air quality days
Mm-hmm.
is rising. Patients are more aware of it, whether it's because there's some press talking about it or because they just feel it. So when I started, as I said, wasn't a standard question. Now it's right in our electronic health record.
Mm-hmm.
What are your triggers for your asthma,
Yeah.
heat, humidity, wildfire smoke? Patients will come in and talk about wildfire smoke, which on the East Coast they never spoke about. So there's a level of awareness, but those days are much worse. My patients, particularly the ones with more severe disease or parents of the kids I see, I'll talk about paying attention to air quality. And there's the airnow.gov site where you can see what your local air quality is. And say there's days you shouldn't be exercising outside, or follow the air quality and try to make a decision. It's challenging because we have some air quality monitoring. Even that is not perfect. So, where I live in Connecticut, my local air quality monitoring is next to a Home Depot, next to the highway in downtown Waterbury. If I go on airnow.gov and look up the air quality for where I live, that's what it's based on. It's 10 miles away from my house and a completely different local air quality paradigm than what's happening at my house.
Yeah.
If things are really bad, it makes sense that they're probably bad where I am. But next to the highway, it's always going to be a little worse than where I live. We need more air quality monitoring, but that's an investment that government has to make. And it's variable. The EPA has some of those sites. The state of Connecticut runs a lot in Connecticut because we're a state that invests in public health. Other states, you can look and realize there's not much air quality monitoring in the entire state unless the federal government is doing it.
It's these are really great insights, honestly. Like these are the things that I hope to make people aware through my work through the series also.
Sure.
I think just to sort of move from stats and concepts to sort of real life stories, and only if that's okay to share, could you share a patient story to illustrate how their case has sort of suffered from climate change impacts?
Sure. I think I would say on a weekly basis, we're seeing patients who are coming in with those complaints of, hot, humid weather, or I can't breathe outside. Again, on the sort of social justice, how do you deal with it issue? I take care of some patients who are landscapers or highway construction workers. You don't have the option of saying, not going to work today because the air quality is bad.
Yeah.
And, it's one of those areas, there's talk now about appropriate regulations for what temperatures it's safe to work. But air quality also has to come into that. There are times where it can just be almost dangerous to be outside when air quality is at its worst. And we see a number of people where they're triggered by this, end up in the emergency room or hospitalized because of bad air quality. Sometimes there's a delayed factor. So when the wildfire smoke was really bad a few years ago, we saw a big increase in viral infections 2 or 3 weeks later. So you have a cycle where air quality gets worse, and that makes inflammation in the lungs worse, and then the patient is more susceptible to getting sick if they develop an infection, and that triggers their exacerbations. So we do see a lot of that. I've had non-smoking friends who've developed lung cancer, and I have to believe that in some of those cases, it's been driven by air pollution. So it's a big concern, particularly when there's things we can do about it.
Thank you for that. I think another question would be, like in your practice, have you come across any common misconceptions that people have? And
Well, when you're in practice, you get to see the full range of political opinions. So certainly, I have patients who will tell me that the climate has always been changing, and it's not mankind doing it, and they've been listening to one television station. So there is that range of misinformation that has been purposeful. And I'm a pretty firm believer in science. I think there is room for skepticism and disagreement in science. When I talk about science and health all the time, I'll say that I trust science, but it's not a matter of faith. You don't lie awake at night wondering whether there is science, which is why we're allowed to study something, look at it, and change our mind as we get better data. Science on climate change itself is really clear. It is happening, and it is driven primarily by man-made activities. There is universal agreement on that, other than on people who are trying to protect special interests that are making money on doing bad things to the planet. The science on science and health is also really clear. Some areas it's still gray because we just don't have enough data. But in other areas, as I said, I've been talking about this for 10 plus years. The data becomes stronger and stronger as we go on. And we know that climate change is causing things to occur that are bad for health. It's primarily focused on respiratory health, but there's infectious disease issues that are occurring. We have malaria happening in the United States, not from people traveling to other areas, but because the environment is becoming more hospitable to mosquito species that carry malaria. So a disease that we haven't had here since the 1700s is starting to pop up again, and it's climate change is driving that. So I think there's skepticism, and even more skepticism about healthcare and public health in general now than there used to be, and it's sad. It's a failure of the educational system. It's a failure of, or an effect of how media has changed. So I think traditional media and social media are both dangerous from a public health standpoint.
Mhm.
And it's something society is going to have to figure out how to deal with if we're going to thrive.
Right. Um, um, I think that example on malaria, one of the few cases that popped up were also in Maryland. I'm based out of DC. And yeah, it was unnerving. I think this also sort of links to the COVID times when it started as a pneumonia, as a mystery pneumonia, and then quickly figured out that it's actually a viral disease due to species crossover. So,
Yeah.
and
Yeah, and I think, there is data, supporting climate change, making pandemic things more likely. I don't think, COVID, for instance, you can look and say it wouldn't have happened without climate change. There's a whole bunch of environmental factors that are going there, overpopulation, how food was handled, and zoonotic human interactions, that some of it is climate driven, some of it isn't. But climate change doesn't make those pandemics less likely. Even the fact that we're spending more time indoors
Mhm.
at times of the year because of heat
Mhm.
is making, you know, uh, making infections more likely to spread person to person.
Mhm.
So our viral season typically follows our school season. Uh, Kids are a great vector. Particularly little ones, they don't follow the best hygiene, and then they come home and spread it to mom and dad and grandma.
Mhm.
But they're also congregated in one small space.
Mhm.
In the summertime, when people are outdoors and not as closely packed,
Mhm.
and kids aren't in school, there's less viruses. But when it gets so hot that no one wants to be outside, we see viral infections rise again. So definitely, there's again a lot of interrelatedness here.
Mhm. There's a lot of overlap. It's not an issue that's in silo, and then climate change is just adding to that spice mix. It's just turning up the volume of each and every risk factor. I think then one thing that I'm trying to do is leave audience with more solutions and actions to sort of cut through the doom and gloom, because the science right now is observing. And one reason I started this series was also to learn about solutions as I'm going along. So, are there any like policies, community actions that you'd like to see? And then also, if you could share some resources that I can use.
Sure. So the Yale School of Public Health has a great climate and health section. Actually, know a couple of people have done their certificate training, which is robust. It's an international program, but they have good resources. Their 5 facts are my go-to whenever I'm giving a talk, and their 5 facts are: climate change is real. It's us. It's bad. um, and it ends with, but there's hope. And I think you can't undersell the hope part of this. This is a serious um, and bad environmental change that is occurring.
Mhm.
But we can mitigate and decrease the problems that climate change is causing, and the sooner we act as a society, the better. In terms of how I approach this individually, there's a few things. As a healthcare provider, we've had a conversation today about healthcare effects. I try to talk directly to my patients about this whenever it comes up. So when somebody says, when it was humid, I couldn't breathe, I talk a little about air pollution and why it's hard to breathe on those days, or when the wildfires are occurring. And I make the connection between climate change and those things. And I think any healthcare provider can do that.
Mhm.
People still trust their doctors for the most part.
Mhm.
We talk about climate change and health. It helps get the message out there. Um, Even though the current administration in Washington is not very friendly to science in general, to climate change in particular, and to healthcare in particular, there's a lot we can do on the state and local level to address this. Yes, we'd love to have proponents in Washington who were taking appropriate action and regulation and putting the dollars where they're needed, but state level action works. So it's important for people to be advocates and talk to their local leaders and their state legislature, or if you're not happy with the answers you're getting from them, to either run yourself or find somebody who's willing to step up and take action. I think we still have a democracy, and the best way to achieve change is put pressure on the people in charge to make the changes that need to be made. And if they're unwilling to make them, vote them out of office. And I'm pretty nonpartisan about this. It doesn't matter what party somebody runs for. It's what actions they're taking to make the world a better place. So you just need to find the people that support common sense and understand what problems we're facing. There's certainly actions we can take as individuals that sometimes they may be more symbolic than world changing, but they also help create momentum. So I have a less than 10-mile commute to my office. I've been driving an electric car since 2013. I was a very early adopter because I looked at my wife and said, I'm the poster kid for an electric car. When I got mine, multiple friends of mine looked and said, this is really cool, and went out and did the same. So I'd like to think I helped drive that change. Is the entire group of people around me going to change the world? No, but it's a domino thing. If we find ways to lower our own carbon footprints and model good behavior, other people see it and learn from it, and our kids see it and learn from it. My youngest child is a bigger environmentalist than I am, and I take pride in that. But it didn't come from nowhere. They just have taken it to the next level. So I think it's important that we teach our children how we are interacting with the world and then try to make it a better place for the next generation. I just think that's what people are supposed to do. I think there are some people in power who don't share that vision, but they shouldn't be in power.
Well, yes, but no, thank you for describing that from like federal level to like very grassroots level specific
Yeah,
action.
and I think there are you need to find the organization that you can get involved with and and support and volunteer time with.
Sure.
There's lots of people working on this. I think when you go out and talk, you realize that there is a robust majority who are concerned about climate change, who are concerned about healthcare, who are concerned about the environment, and you just need to find people to share that voice. And sometimes it's when things seem dismal, I go out and seek other people to be reminded that we're not alone in this. It's valuable to know that we've got a tribe that wants to make the world a better place and is concerned about these things.
That's beautiful. I think this was very, very rich, and it's given me so much fodder. I think I can bring this to closing now. So if
Sure.
you get every reader to remember just one thing about, this issue of how climate is so intricately tied to our lungs, what would it be?
So I think for people concerned about their own health, it would be to pay attention to air quality. It should be part of your routine weather report, just like you're saying, should I put on sunscreen? Is it going to rain? Do I want to have an umbrella? What's the air quality going to be like, particularly if you're contemplating outdoor activities? I'm going to go for a run or a bike ride. I'm going to send my kids out to the park. And then I think in the big picture thing, it's speak up, get involved, create the change you want to see in the world.
I see where Sarah gets it from.
Thank you.
Thank you. Was this gave me a lot of material, and it is exactly why I started this series, because I feel like we have the science, we've done enough problem diagnosis, but what we lack is sort of to humanize the issue, and I feel health brings that angle where we can humanize that. Look, the cost is us. It's not the trees. It's not anybody. The trees are us. We are here because of, forests and our biodiversity. Um,
But yeah, I think healthcare is really personal to people.
mhm,
It brings the message home differently than it's hot out
mhm.
or we're going to get a bad storm.
Yeah, yeah,
It's that concept of your kids can't play outdoors without getting sick.
yeah.
You know, you're risking your life because we're not acting on climate.
Yeah, exactly. So thank you. Thank you for making time for me.
Oh,
Um,
you're welcome. I'm glad I could help. And yeah, definitely if there's a question that we didn't address or something comes up as you're looking at this, feel free to shoot me a message, text, or email, and
thank you so
I'll
much.
help out.
Sure, thank you. I should have added in my introduction, but I'm a pharmacist by training.
Wow. So you're a healthcare worker as well.
But I worked in global health and international development, but so that's the angle I bring into this, and that's why I'm doing this series.
I appreciate it, and you know it is all interconnected. It's
Yeah.
you know, the challenging thing is when you start looking at that web,
Mm-hmm.
is that are where things are not being done well in this country. A lot of it stems from the same
Mm-hmm.
uh, problem, and it's probably a problem in late stage capitalism that's driving a lot of it. Um, it's I'm not necessarily an anti-capitalist, but I think there's certain areas where it fails.
Yeah.
Uh, Healthcare, particularly on the public health side, is one of them.
Yeah. Yes, definitely. Um, Thank you. That was also very powerful concluding thoughts. So, yeah,
Sure.
so many good pieces now.